Hi, I'm Melissa Chalker, Executive Director of the New Jersey Foundation for Aging. Welcome to Aging Insights. Aging Insights is a production of the New Jersey Foundation for Aging. NJFA's mission is to enable New Jersey older adults to live with independence and dignity in their communities. Aging Insights is supported through sponsorships and viewer donations. If you're interested in becoming a sponsor, please go to our website at www.njfoundationforaging.org or call us in the office at 609-421-0206 for more information. Today we're joined by one of our favorite guests. Charles Clarkson from the Senior Medicare Patrol is here with us today to talk about all things Medicare. It's that time again for open enrollment. You will get all the details you need and more, as well as tips and information regarding scams and your Medicare benefits. Thank you, Charles, for joining us today. We're always happy to welcome you back to Aging Insights because you are our Medicare guru. You tell us all the things we need to know. So as I mentioned,
thank you for having me again.
Yeah, always happy to have you. So as I mentioned in the open, we are dealing with Medicare open enrollment. So can you remind our audience what Medicare open enrollment is, when it starts, all the things they need to know?
You know, every year beneficiaries in Medicare have a right to make changes, and that change period is called open enrollment. It goes from October 15th, which is just right around the corner, through December 7th, and we encourage every Medicare beneficiary to review their Medicare coverages. Their Part D plans, their drug plans, if they're in a Medicare Advantage plan, because they're allowed to make changes. If they're in original Medicare, they can go to a Medicare Advantage plan. If they're in a Medicare Advantage plan, they can go back to original Medicare, or they can change from one Medicare Advantage plan to another. And the reason they have to do this is because these plans change every year. The rules change, the coverage change, the premiums change, the cost changes, and if they don't do a review, they can actually lose money by staying where they are or might not get the best coverage.
Sure. So just so our audience is aware, can we just go back a little bit and remind people what the difference is between original Medicare and a Medicare Advantage plan?
Sure. Original Medicare is Part A, which is hospital coverage. Part B, that's called original Medicare, but people combine that with usually a Medicare supplement plan and then a Part D drug plan for their drug coverage. Right. A Medicare Advantage plan is a private company that offers all the services of original Medicare, and it also may include drug coverage. And in most cases, it does include drug coverage, so you don't really need to buy a Medicare supplement plan. You don't need to buy a drug plan. Right. But the difference is the Medicare Advantage plan will have a network. Right. And you must go to a doctor or a hospital in the network. They also might have rules that you have to follow. They might need pre-authorization to get certain tests, and that's really the big difference.
Right. So just, as I'm understanding it, original Medicare, Parts A and B that come from
the federal government.
From the federal government, and last time you were here, we talked about the new cards, right? So everyone knows now they get their new Medicare cards with their new identification number on there. So that's your original Medicare, and usually, as you said, people need to supplement that with a.
That's correct.
Sometimes we call that a Medigap plan, is that right?
Yeah.
And then making sure that they have something to cover their prescription drugs.
Correct.
But Medicare Advantage is all that into one, but not from the federal government, from an insurance company, right?
That's
from
correct.
your big
They're approved by Medicare, but they offer the same services, but you have to really understand what's in those plans and whether your doctor is in that network, because why would you want to stay in that plan if you want to continue to see your doctor and that doctor's not in the plan anymore?
Right. So this once-a-year time from October 15th to December 7th, open enrollment, is when they can make those changes. What are some of the things they need to look at and consider in those decisions?
Well, of course, the premiums can change. The deductibles can change. If you're in a Medicare Part D plan, let's say, how do you know all your drugs are still covered?
Right.
You know? And you don't want to be in a plan where maybe your drug isn't covered while there's another plan out there that does cover your drugs. And also, these Part D plans put drugs in tiers. The higher the tier, the higher the copay. So when you want to have a chance to do a search on these plans, you want to see what tiers those drugs are in, because then you could determine, well, if I'm in this plan and my drug, which is expensive, is in a lower tier, I could save money over the entire year. And that's what you want to look for.
And the tier will determine how much you have to pay?
Yes, what the copay is when you go to the pharmacy.
Gotcha.
So if you're in a tier 3, you know you're going to pay a pretty penny for your copayment for that drug.
Right. And so you want to make sure you're considering that in selecting a plan.
Right.
So
and some Part D plans, even though they're allowed to have a deductible, some plans may not have a deductible. But you have to presume that if they don't have a deductible, their premium may be higher. So what I tell people is ignore the premium. What you want to find out is what the total annual drug cost over the entire year is. Okay? And then, of course, if you're searching and comparing Medicare Advantage plans, you have to check, are my doctors still in the plan? A doctor can drop out of a Medicare Advantage plan anytime they want. Right. So you have to really make sure your doctors are in the plan.
Yeah. So that's a good thing to know, to look at the networks and if your doctor's in network with the various plans you're considering. Correct. And also if the drugs you're taking. And so how do people get information specifically about that, about the drugs?
Okay, Medicare makes it somewhat easy. There is a plan finder. If you go to medicare.gov and you say search drug and health plans, you can do a comparison of Medicare Advantage plans and Part D drug plans. And when you come to Part D, you will actually put in all your drugs. Right. And then you can basically, based on your drugs, the dosage, you could determine what the costs are for those plans. Now, there's a problem. Then there's a new Medicare plan finder that just went into effect. Okay. And right now, they're not allowing you, or they don't have the ability to do the total annual cost, which is a real problem. Right. And they're saying to us they hope to have it in by October 15th, so stay tuned.
Right, so hopefully during open enrollment period, people will be able to look at that. But,
that's correct.
But, to be able to at least to get that information. I understand that the insurance companies have to make their formulary available. Is that the right term?
Every year when you're in a Part D drug plan, you get an annual notice of change. Okay. But it's 30 pages long, and very few people actually read all of it. So what I always suggest is, once you do some kind of research, if you want to really double check, call the plan. Right. And say, hey, I'm just double checking to make sure all my drugs are on here, what the formularies are, what tier they're in. But hopefully the plan finder will make that easy for you. Right. But we're keeping our fingers crossed that it's ready to go by open enrollment.
Right. So people should be looking out that during this period they're going to receive that annual, what was it called again?
They should have already gotten it, the annual notice of change.
Annual notice of change, and that comes from their insurance company?
Yes, that's correct.
And so that's in particular related to Part D, or is that for all plans?
It's mostly for Part D, but it could also be for Medicare Advantage plans. And you have to understand that if I'm in a plan, let's say I'm in the Aetna Part D drug plan, and I'm going to do a search and say, oh, is Aetna the best plan for me next year? And if it's not, why do I want to stay with Aetna when I can save money? And actually, I just was reading an article yesterday that most people, when they do a search and they actually change plan, they actually save at least 5%. On their cost for the year.
So it's worth it to do the research and really look into it.
And a lot of people have never done this. So they're in plans.
Sometimes it's easy just to say, this is my plan, I'm going to stick with it, right? But there is an advantage.
Right, because you can go to the pharmacy January 3rd after New Year's and say, uh-oh, my drug is not in the plan. Right. I have to pay the whole price. That is not a good thing.
Right. So this is a good thing that you've said to just remind me that we've told them that their open enrollment period is from October 15th to December 7th. Those when they can make the changes, but the changes take effect January 1st, right? Right. So while you make the change sometime between that period by December 7th, you could expect the changes take place January 1st. So
right, and you really should do it because once December 8th comes, you cannot make any changes.
You can't make any changes,
right? You cannot make any changes unless you have a special reason or a special enrollment period because let's say you moved out of state and your MA plan is no longer in that state, then you have special enrollment periods. But we're not talking about that. We're just talking about Medicare open enrollment.
And so we've established that during this time, people can change from original to a Medicare Advantage or Medicare Advantage back to original. And if they're sticking with original or if they're moving to original, that's also the time to choose a Part D and a supplemental. They can change.
Right. Now a supplement plan, they can change it anytime they want.
Okay.
But you have to understand, when you first enroll in Medicare, you can buy a Medigap or a supplement plan, and they cannot turn you down for any reason, no matter what your health condition is. But once I have Part B for at least 6 months, then that guaranteed right period is over. So right now, if I want to change a Medicare supplement plan, and I have, let's say, a heart condition, they can say, no, we're not taking you. Or no, we'll take you, but there'll be a waiting period. So you always have to make sure before you switch supplement plans that you're in a new plan, and otherwise you really could get screwed.
Yeah. So, I mean, there's so much that goes into this and so much to know.
That's right.
And so it's important that people review the paperwork, that they use the tools available. So you mentioned
That's right.
Medicare.gov, which is a great place for people to go. Where else can people
Okay,
turn
now
for?
the big thing is, yes, there is a program in every state called SHIP, State Health Insurance Assistance Program. And in many states it's a different name, but in New Jersey it is SHIP. And people should call the SHIP program and make an appointment with a SHIP counselor. They're well trained. They're not selling anything. All they want to do is help you to put you in the best plans or recommend what the plans is. They can't tell you to join this plan, but they can say, look, these are your choices. This is what the cost is. You decide and let them help you because it's complicated.
Yeah, so this is a great thing because, you know, you mentioned before calling your insurance company with questions, and certainly you can call there and ask specifics about their plan, but of course they're going to want you to stay with them.
Of course.
Where the SHIP counselor, that's usually available by county, you call your...
Yes, every county has
their
SHIP counselors. They're well trained, and they get update training all the time.
Exactly. And they're, as you said, they're objective. They're not going to be saying, oh, no, you definitely should go with Aetna, or you should go with this, or, you know, XYZ plan.
And I know people are not going to like this, but I never like to use an agent or a broker because I'm never sure whether they're going to be objective. But take advantage of the SHIP program. They're federally funded and they're free.
Right. So it's free. They're objective. They get great training, and you can call your county office on aging and find where a SHIP counselor is in your area. And if you're sitting with all this paperwork and all these decisions and you have questions, it's good to know that there's help out there for people who are struggling through this, because there is a lot that goes into it. And so is there anything else that you think beneficiaries should know about the open enrollment period that we haven't covered yet?
Yeah, well, if you're going to make an appointment with a SHIP counselor, don't wait.
Yeah.
Because they get extremely busy. I know I'm going to volunteer like 7 days at the Monroe Senior Center to help all day people with appointments to come in and look at their Part D plan. But very few percentage of actual people actually consider changing plans. That is not a good idea. So really, call up, make an appointment for after October 15th, because in case you want to get enrolled, they can do it right for you. So you call now, make an appointment in your county. Usually start with the Office on Aging to see if they have a an open enrollment period where you can come in, or just make an appointment with a counselor and go see them and really sit down. It's worth the time.
Sure, that's terrific advice, and so I hope that people do reach out and make an appointment. So we talked about some of the other plans, and you mentioned for the supplemental plans you can kind of do that outside of the open enrollment. Are there any other enrollment periods that people need to know about? Because I know things change in the Medicare world.
There are a lot of enrollment periods.
Yes.
First, when you first turn 65, there's the initial enrollment period, where you can 3 months before the month of your birthday, the month of your birthday, and 3 months after, you can enroll in Medicare. Then there's the general enrollment period. Every year from January 1st to March 31st. Let's say I didn't join Medicare when I first should have. Well, every year from January through March, I can enroll in Medicare for the first time and then get all the other parts.
So that general enrollment period
only if you're not
already enrolled. So
That's
you
right.
can't enroll or make any changes in your enrollment during that general period. That's only for people who miss the opportunity to enroll during their birthday time, right?
And then there's the a new
I was going to say this. I know there's a new one. So
called the Medicare Advantage Open Enrollment Period. So on January 1st, if I'm already in a Medicare Advantage plan, I'm allowed to change to another Medicare Advantage plan for that period of time from January 1st also through March 31st.
So the same as the general period as a Medicare, but you can only switch within Medicare Advantage? Can you go back to open enrollment or go back to original in that period?
That's what I'm saying. That's why it's called a Medicare Advantage Open Enrollment.
I just want to make sure people were clear about that.
It used to be called a Medicare Advantage Disenrollment because you couldn't disenroll and go back, but now they changed that.
Now they changed.
If you're already in a plan, you can change to another plan.
If I was with ABC and I'm not happy, I can choose XYZ company instead. Okay.
I told you it's complicated.
It is, which is why people need you and SHIP counselors and all the help that they can get in Medicare.gov as a great resource.
And of course you have special enrollment.
Okay.
So let's say I'm in a Medicare Advantage plan and I'm covered in the state of New Jersey, but I moved to Pennsylvania. My plan may not follow me to Pennsylvania. So then I have a period of time to basically enroll during that time without being penalized.
Right.
And we never even talked about the penalty.
Well,
but
yeah, maybe we should. So if I've waited and if I've turned 65 and it's 3 months after my birthday and I didn't enroll in Medicare and the general enrollment period rolls around, what happens when I enroll
if I didn't
then?
enroll, let's say, in a Part D plan that I didn't have like employer coverage, because if I'm still working and I have employer coverage, I don't need Part B. I can wait.
Right.
But if I don't and I wait, I could be penalized 10% for every full year that goes by.
So for a year that goes by. So
Every
if it's just
full
a
year.
So if it's a couple of months that have passed,
You're okay.
You won't
Yeah,
get the penalty. It's
that's
only if a
right.
full year has
Now,
passed.
for Part D, it's different.
Okay.
Part D, if I don't have credible coverage from another source and I could have enrolled in Part D, I'm going to be charged 1% for every month I didn't enroll in a Part D plan. And
Okay.
these penalties last as long as you're in Medicare.
So every time you are enrolling in your
you-
Part D plan, you're going to pay that additional 1%
That's
for
right.
every
and
month
you have
you
to
didn't have a
remember
plan.
the penalty is based on the average cost over the country, and every year, if
on your specific.
that's right, not on your
okay.
specific plan that you pick. So
Okay.
as the average keeps going up and up and up, your penalty can keep going up
So,
and up and up.
so the lesson here is it's really important to if you can avoid the penalty.
That's right.
Yeah?
Avoid the penalty. You know.
Because the penalty isn't a flat thing the whole your
And a
whole
lot
time
of
it's
people
going to
don't
go
know
up.
about the penalty, and
Yeah.
they're shocked.
Yeah.
They said, "What? I have
Yeah.
to pay a penalty?"
Because there's so many things we need to know about
I know.
Medicare, right? So
Right.
that we should all be paying attention now so that we know when we get there what to do. So we talked about SHIP counselors and using them to your advantage to learn all of those things. But let's talk a little bit about what you all do at the Senior Medicare Patrol.
Yes.
You do so many things there as a program, and one of those is to inform people about fraud and what to look out for. And you've given us already such great information about open enrollment. So I'm going to ask you, I'm seeing so many commercials hearing them on the radio, seeing them on TV that are related to Medicare plans and what you can get. What do people know about? What should people know about advertisements? What do they need to know about looking out for fake sort of advertisements?
Yeah,
or
we're very
scams?
concerned about that. And our advice is this: turn off the sound when you see the commercial about Medicare. Don't listen. Don't follow their advice because they just want you to join their plan. And you can have a lot of unscrupulous brokers and agents who want you to join plans. You might get a lot of telephone calls. And they want to take advantage of the open enrollment period because they know people know they can make changes. So it's like any other advertising. Hey, we're great. Join us. So we recommend that you don't. And another thing, don't follow your neighbor's advice. They have no idea.
Unless they're a SHIP counselor.
That's right, unless they're a SHIP counselor. I'm in this plan. I love my Part D plan. It's wonderful, but it may not work for you.
Right.
So you have to really, really be careful. And, we see a lot of, unscrupulous solicitations and, people trying to get people to join plans. You're going to get a lot of things in the mail, too.
Right.
I would just rip them up and throw them away. Go talk to a SHIP counselor.
So, you're going to see advertisements, but make sure you still do your research and do your homework to find out what plan works for you and get the real deal information, because we know, as you said, there are folks out there. And we always want to remind people that, especially with phone calls, that, they have to verify that the person is
I want to give
who
a
they
word of
say they are.
advice about
Yeah.
telephone calls.
Yeah, please do.
If you don't have a message machine with a screen that tells you the number, please get one. And the word of advice is, if you see a number that you don't recognize, never pick up the telephone. I mean never. Okay, I know you're lonely.
Screen
you're
your
sitting
calls.
right.
Screen
Screen
your
all
calls.
calls. Okay, I even don't even pick up my sister-in-law's calls because
Oh,
I see her.
hope she's not watching.
No, she won't. I'm sure she won't. That was a joke, by the way. But really, because we're talking about billions of calls, billions.
Yeah. And so whether it's about Medicare open enrollment or something else related to your Medicare,
Social Security, fraud, IRS, everything.
Don't give people your social Security number, and now we should Medicare number. So we should remind people who that if they don't know already, that they should have gotten their new Medicare card.
That's right.
Which no longer has their Social Security number on it. Correct.
That's correct.
And this was a measure to protect.
Called
Yes.
a Medicare Beneficiary Identifier, an MBI. No one's ever going to call it that. It's going to be called the Medicare number. But one of the advantages of this new randomly generated number is if you lost your credit card, you call your credit card company and they get you not only a new card, but they would change the number. we can now do that with Medicare. If you tell us that your number is compromised, we'll get you a new card and we'll get you a whole new MBI, Medicare Beneficiary Identifier, which is a big deal.
That is a big deal because before, when it was tied to your Social Security number, if somebody got your Social Security number, you can't change that, really.
That's right.
There's very
Even
few
if you got a
instances.
new card, you would still get the same number.
Exactly.
So it didn't really help very much.
It didn't really help. So this is a new system built in with this new identifier so that
Right.
people can be protected against
Right,
fraud.
but you still have to protect your Medicare card and the Medicare number because that's still very valuable.
Yeah.
People can use it in your name if they have your name and number and card. So you have to be very, very careful.
So before we delve more into the different types of fraud to look out for, remind people what the Senior Medicare Patrol is and what you guys do there.
Okay, well, basically, we're federally funded by the Administration for Community Living, and our job really is to educate seniors to protect them from Medicare fraud, waste, and abuse. And we do that by outreach. I think last year we did over 225 presentations. We go to community events like health fairs, and we give out information. Of course, we answer people's calls all the time about Medicare fraud, waste, and abuse, and we'll actually, review them. We have a lot of volunteers who really love to basically help people fight Medicare fraud. We assign a volunteer to a person, and that their job is to get the facts and try to resolve the fraud or the error, and try to get the money back to Medicare if Medicare already paid out the money.
So this is a really great federally funded program,
Correct.
Volunteer run, where you're training lots of great volunteers who will take questions, calls, and concerns about fraud. So
Correct.
How would someone know that they might be a victim of Medicare fraud?
Okay, well, there are a couple of rules. Rule number one, read your Medicare summary notice
Yes, so
very carefully, or your explanation of benefits if you're in a Medicare Advantage plan, because you don't know until you read your statement what doctors have charged, what hospitals have charged. They make mistakes.
Yeah.
And sometimes those mistakes are intentional,
Right.
which is called fraud. So first thing you have to do is read the Medicare summary notice carefully. It comes in the mail every 3 months if you've seen a Medicare provider. But what people don't know, and what I'm shocked about, is that you could also open an online My Medicare account.
Yes.
And you can see your statements online as soon as they're posted. You don't have to wait the 3 months. So we recommend that you open a My Medicare account and be able, and not only that, if you lost your card but you didn't think it was compromised, you could actually print out. You could actually print out a new card for yourself under a My Medicare account.
Okay, so this is great. So we know that the Medicare summary notice comes in the mail,
That's
but
right.
you can opt online to create your My Medicare account,
Right.
And you can go anytime and log
Anytime.
in and check
Anytime, day
that
or
summary
night,
notice. And
you
the
know?
summary notice includes what information? What doctor you've seen
Yeah,
and what
it
they.
includes the date. Well, there's a period of time it covers,
Right.
usually 3 months. Okay, so you look at the date. There's a description. There's the name of the doctor or the name of the hospital.
Right.
And what you want to say is, okay, was I there that day?
Right.
Do I know this doctor?
Right.
Did I
I-
get this test? Did I
Yes.
get this service? And then, of course, look at the amount. I always say to people, if I'm going in for a checkup and they're charging me $5,000, something is wrong.
Right.
And, so the first thing we tell people is, call the hospital, call the doctor and say, look, you made a mistake.
Right.
I didn't get this test. Please correct it. But a lot of times there really isn't any follow-up.
Right.
So you can call Medicare, 1-800-MEDICARE, or you can call the Senior Medicare Patrol at 732-777-1940 and ask for the Senior Medicare Patrol program.
Great. And so the volunteer who gets assigned to you, if you call Senior Medicare Patrol, will investigate that and try to get a solution for you and figure out
Correct.
where this fraud or
Absolutely.
abuse may have taken place.
Right, and we're free, and we're very nice.
Yes.
So let us help you. And even if you're not sure, I always tell people, if you're not sure, call me or call us, because we have a lot more expertise than you do.
Right.
And, if we call a provider, sometimes we have a little more power than the beneficiary.
Right.
And, if we say, well, we'll refer it to the Office of Inspector General, the doctor might get a little nervous and might want to, resolve the issue.
Right. So it's really important to read that Medicare summary notice. And you
Absolutely.
said if someone's in an Advantage plan, it's going to look different because it's going to
it's
come
called
from
an
their.
explanation of benefits
Right.
from their plan.
Right. So it's going to say the name of your plan on the envelope versus,
Yeah.
that, and then it's going to say
Absolutely.
explanation of benefits, but it's essentially essentially the same thing.
Yeah, you
look
have
at
to
those
read it
dates, look at the
carefully.
doctor, look at the amounts, the type of description
Everything.
of the service, all of those things, right?
Correct. Absolutely.
So, and again, if they see anything there, they're going to call you and say,
Hopefully.
hopefully, yeah, hopefully they're watching and they're gonna see that there's an issue and that they're calling to get
Right.
that resolved.
And
Right?
another thing people should do is, look, we probably don't remember what we did 3 months ago.
Yeah.
So I encourage everybody, keep a calendar every time you go to the doctor, every time you go to the hospital, every test you take, every lab you went to. And then when you get your Medicare summary notice, you compare the two and you say, oh, okay, everything that I have on my calendar seems to be in my Medicare summary notice. I don't think I'm being cheated.
Yeah.
And we hand out personal health care journals, actually, and every time we do a presentation, because we want to encourage people to do that.
That's a great advice. I really think that if you're going to keep a journal to know and compare to your summary notes, because it is hard to remember. Where,
It is,
did I go? Did I go that day? What day did I go?
Yeah. When I go to a presentation, I'm usually the youngest person in the room because everybody's much older than I am. And I say, look, I can't remember what I did yesterday.
No.
How am I
It's
going to
true.
remember what I did 3 months ago?
Yeah.
So write it down.
Write it down, exactly. So that's really good advice. And for anybody watching who wants to invite the Senior Medicare Patrol to come,
we'll come out and
do a presentation to their group and provide journals for everybody.
Journals, we have bags, we have brochures.
They've got lots of swag.
We have to-do pads.
Lots of swag.
Right.
Charles, thanks again for coming in and joining us. I always enjoy when you're here every year to give us all the details, and I hope our viewers appreciate the information and use it and call a SHIP counselor or the Senior Medicare Patrol if they need assistance.
Right.
So thanks again for joining us. And thank you for watching this episode of Aging Insights. For more information and to watch previous episodes, please visit our website at www.njfoundationforaging.org and click on the Aging Insights page. Aging Insights is produced by the New Jersey Foundation for Aging and is made possible by sponsors and donations from viewers like you. To become a sponsor, please visit our website or call us at 609-421-0206. And to find out about senior services in your area, including your SHIP counselors, please contact your county office on aging. Their numbers can be found on our website, or you can call the hotline at 1-877-222-3737. Thank you for watching, and be sure to tune in next time.